Hello everyone, welcome back to our channel. Today we're diving into a critical health topic that often goes unnoticed: diabetes. This chronic condition occurs when the body struggles to manage blood sugar levels effectively. What makes diabetes particularly concerning is that its early symptoms can be mild or mistaken for other issues, leaving many people unaware they have it. In this video, we'll uncover 10 signs that could indicate you have diabetes without knowing. Pay close attention, and if you notice any of these signs in yourself, consult a healthcare professional as soon as possible. Diabetes develops when there are issues with the production or use of insulin in the body. In type 1 diabetes, the immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. While the exact trigger is unknown, factors such as genetics or environmental influences like viral infections are thought to play a role. Type 2 diabetes, on the other hand, occurs when the body becomes resistant to insulin or fails to produce enough of it. This form is often linked to excess weight, lack of physical activity, and inherited factors. Gestational diabetes, which occurs during pregnancy, is caused by hormonal shifts and insulin resistance, increasing the likelihood of developing type 2 diabetes later in life. Uncontrolled diabetes can result in a range of serious and life-threatening complications. High blood sugar can damage blood vessels, significantly increasing the risk of cardiovascular diseases like heart attacks and strokes. It can also lead to diabetic neuropathy, where nerve damage causes pain, numbness, or loss of sensation, particularly in the extremities, making injuries and infections more likely. Untreated diabetes can harm the kidneys. Diabetic nephropathy, potentially leading to kidney failure and the need for dialysis or a transplant. Vision problems, such as diabetic retinopathy, can occur when elevated blood sugar damages the tiny blood vessels in the eyes, potentially leading to blindness. Poor circulation and nerve damage can also result in slow-healing wounds, ulcers, or even the need for amputation, particularly in the feet. Skin infections and delayed wound healing are more common among those with diabetes. Women with diabetes may encounter complications during pregnancy, affecting both their health and the baby's development. Dental health is another concern, as high blood sugar levels increase the risk of gum infections and tooth loss. However, with proper management and a healthy lifestyle, these complications can be avoided or significantly reduced. The key to managing diabetes lies in early detection. Blood tests such as fasting glucose, oral glucose tolerance, and hemoglobin A1C are commonly used to identify diabetes. If diagnosed, your doctor will develop a personalized treatment plan, which may include dietary adjustments, physical activity, medication, and regular glucose monitoring. Let's now explore 10 possible symptoms that may indicate diabetes. Remember, while these signs can suggest diabetes, only a medical professional can provide a definitive diagnosis through proper testing. Sign 1: excessive thirst. Excessive thirst, known medically as polydipsia, is often the first noticeable symptom of diabetes and can feel insatiable no matter how much water you drink. This thirst stems from elevated blood sugar levels, which force the kidneys to work overtime to filter and absorb excess glucose. When the kidneys can't keep up, the surplus glucose is excreted in the urine, dragging large amounts of water along with it. This rapid fluid loss leaves the body dehydrated, triggering an unrelenting urge to drink. The cycle of excessive thirst and frequent drinking can disrupt daily life, including sleep. Many individuals find themselves waking multiple times during the night to quench their thirst, or visit the bathroom, leading to fatigue, irritability, and reduced productivity during the day. If you notice an unquenchable thirst, especially when paired with other symptoms like fatigue or weight changes, it's a sign your body might be signaling a blood sugar imbalance. Seek medical advice to determine the underlying cause and get timely intervention. Sign 2. Frequent urination. Frequent urination, or polyuria, is not just a matter of inconvenience. It's a telltale sign of diabetes that reflects the body's struggle to manage excess glucose in the blood. The kidneys act as natural filters, attempting to excrete surplus glucose through urine. This process increases urine output, sometimes to the point where individuals may urinate as often as every hour. What makes this symptom particularly disruptive is its impact on sleep, known as nocturia, where frequent trips to the bathroom disturb restful sleep cycles. Over time, this lack of quality sleep can lead to chronic fatigue, irritability, and impaired cognitive function. Moreover, the dehydration caused by frequent urination exacerbates other symptoms, such as dry mouth, dizziness, and persistent thirst. While polyuria can also be linked to urinary tract infections, prostate issues, or excessive fluid intake, its association with high blood sugar levels makes it an essential red flag for diabetes screening. Sign 3. Excessive hunger. Excessive hunger, or polyphagia, goes beyond regular appetite fluctuations. It's a distinct response to the body's inability to effectively use glucose for energy. In diabetes, glucose, the body's primary energy source, remains trapped in the bloodstream. Because insulin either isn't produced in sufficient amounts or isn't functioning properly. As a result, the cells send signals to the brain indicating they are starving, even though the bloodstream is flooded with glucose. This relentless hunger often leads to cravings for high-carb, sugary foods, as the brain attempts to quickly restore perceived energy deficits. Unfortunately, consuming these foods only exacerbates the problem by further spiking blood sugar levels. Polyphagia can also contribute to weight gain, especially when paired with a sedentary lifestyle, worsening the body's insulin resistance. Interestingly, some individuals with uncontrolled diabetes experience paradoxical weight loss, despite eating large amounts, as the body begins breaking down muscle and fat for energy. If you find yourself constantly hungry, especially in combination with unexplained weight changes or fatigue, it's a clear signal to consult a healthcare provider for further evaluation. Sign 4. Unexplained weight loss. Unexplained weight loss, particularly rapid and significant, is often one of the most noticeable symptoms of diabetes, especially type 1 diabetes. This occurs because the body, unable to utilize glucose as a primary energy source, due to insufficient or ineffective insulin, turns to alternative energy reserves. It begins breaking down fat and muscle tissue to compensate for the lack of available energy. This process not only leads to noticeable weight loss but can also result in muscle weakness, reduced stamina, and a gaunt appearance. Unlike intentional weight loss from diet or exercise, this symptom happens regardless of food intake, often leaving individuals puzzled or even concerned. In type 2 diabetes, weight loss may occur later in the disease progression, particularly if complications like poor nutrient absorption arise. If you notice sudden weight changes without altering your lifestyle, it's essential to consult a healthcare provider immediately for evaluation. Sign 5: Fatigue. Fatigue in diabetes is more than just feeling tired after a long day. It's a deep, persistent exhaustion that affects every aspect of life. The root cause lies in the body's inability to properly use glucose for fuel. With glucose trapped in the bloodstream instead of entering cells for energy production, your body is left running on empty, no matter how much rest you get. Frequent urination and dehydration compound this fatigue. Dehydration reduces blood volume, which can lower blood pressure and slow the delivery of oxygen and nutrients to tissues. Additionally, fluctuating blood sugar levels either too high or too low disrupt the body's equilibrium, leaving you feeling drained. This relentless tiredness can make even simple tasks, like climbing stairs or concentrating at work, feel overwhelming. Fatigue is also closely linked to the emotional burden of managing diabetes, further amplifying the feeling of exhaustion. If you find yourself constantly tired without explanation, it's a sign to check in with your doctor. Sign 6: Blurred vision. Blurred vision is one of the more subtle yet significant warning signs of diabetes. High blood sugar levels cause the lenses in your eyes to swell by pulling fluid into them, which affects their ability to focus. This distortion of vision often comes and goes, depending on how well blood sugar levels are controlled. Over time, if blood sugar remains elevated, more serious complications can develop. The delicate blood vessels in the retina can become damaged, leading to diabetic retinopathy, a condition that can cause vision loss or blindness if left untreated. Early on, this may manifest as seeing floaters, dark spots, or difficulty distinguishing colors. Interestingly, blurred vision may also improve temporarily in individuals newly diagnosed with diabetes who start treatment. As blood sugar stabilizes, swelling in the eye lenses decreases, leading to clearer sight. Regular eye exams are crucial for catching vision changes early, as they can often indicate worsening blood sugar control even before other symptoms appear. Sign 7: Slow healing of wounds. When you have diabetes, even minor cuts and scrapes can turn into major concerns. High blood sugar levels damage blood vessels, reducing circulation and slowing the delivery of oxygen and nutrients to the injured area. Without these essential resources, the body struggles to rebuild tissue and fight off infections, prolonging the healing process. Elevated glucose also weakens the immune system, leaving wounds more susceptible to bacteria and other pathogens. This delay in healing is most commonly observed in the feet, where reduced sensation caused by nerve damage can prevent individuals from noticing small injuries. Left untreated, these minor wounds can develop into chronic ulcers or infections. In severe cases, such infections may spread to the bone, sometimes requiring amputation to prevent further complications. Regular foot checks, proper wound care, and maintaining stable blood sugar levels are essential for preventing these serious outcomes. Sign 8: Skin signals. Diabetes often leaves its mark on the skin, signaling deeper health issues through a variety of symptoms. One common issue is dry skin and persistent itching, which can be more than just a mild irritation. Frequent urination, a hallmark of diabetes, causes dehydration, stripping the skin of essential moisture. This leads to flaking, cracking, and tightness, particularly on the hands, feet, and lower legs. Poor circulation, another complication of diabetes, worsens the problem by slowing the delivery of nutrients to the skin, weakening its natural barrier. In some cases, diabetic neuropathy can cause nerve damage that sends abnormal signals to the brain, resulting in sensations of itchiness without an obvious external cause. Furthermore, dry, irritated skin creates an ideal environment for fungal infections like athlete's foot or jock itch, especially in warm, moist areas. Another noticeable skin-related sign of diabetes is acanthosis nigricans, a condition marked by dark, velvety patches that often appear in the folds of the neck, armpits, or groin. These patches are caused by elevated insulin levels, which stimulate skin cell growth and pigmentation. While these patches aren't harmful, they are an early warning of insulin resistance, a condition closely linked to type 2 diabetes. The affected areas may also feel thicker, rougher, or slightly itchy, and in some cases these changes can extend to the knuckles or elbows. Sign 9: Tingling and numbness. Tingling and numbness in the hands and feet, commonly referred to as diabetic neuropathy, is a serious symptom of prolonged high blood sugar levels. Over time, excess glucose damages the delicate nerve fibers, particularly in the extremities, leading to sensations of tingling, prickling, burning, or complete numbness. Peripheral neuropathy is the most common type and typically affects the feet and legs first, later progressing to the hands and arms. As this condition worsens, it can cause pain, muscle weakness, and loss of coordination, increasing the risk of falls and injuries. Another form, autonomic neuropathy, affects involuntary body functions, leading to issues like difficulty digesting food, bladder control problems, or even irregular heartbeats. This symptom isn't just about discomfort, it's a red flag for significant nerve damage that could lead to more severe complications if untreated. Regular foot checks, blood sugar control, and early medical intervention are key to managing and preventing the progression of neuropathy. Sign 10: Oral infections. Oral infections, such as gingivitis and periodontitis, are far more common in individuals with diabetes due to elevated blood sugar levels. These heightened glucose levels feed harmful bacteria in the mouth, creating an ideal environment for plaque buildup, gum inflammation, and infection. Gingivitis, an early stage of gum disease, presents as red, swollen gums that bleed during brushing or flossing. If left untreated, it can progress to periodontitis, a more severe infection that damages the tissues and bones supporting the teeth. Periodontitis not only threatens oral health, but can also exacerbate blood sugar control, creating a vicious cycle. In extreme cases, untreated infections can lead to tooth loss or systemic complications. To combat these issues, it's essential to maintain excellent oral hygiene, including regular brushing, flossing, and dental checkups. For people with diabetes, controlling blood sugar is just as important for oral health as it is for overall health. Using antimicrobial mouthwashes and avoiding sugary foods can further reduce the risk of infections. These 10 signs could be indicators that you might have diabetes without realizing it. If you recognize one or more of these symptoms, it's important to consult a healthcare professional for a thorough evaluation. Detecting diabetes early is essential for effective treatment and the prevention of complications. Adopting a healthy lifestyle plays a crucial role in both preventing and managing diabetes. This includes eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, staying physically active, and maintaining a healthy weight. Reducing your intake of refined carbohydrates and sugary foods is also key to stabilizing blood sugar levels. How is diabetes managed? Beyond lifestyle adjustments, managing diabetes often involves medications or insulin therapy. Different medications work in various ways to regulate blood sugar levels. For individuals with type 1 diabetes, insulin is essential, while some with type 2 diabetes may also require insulin therapy. Monitoring blood sugar levels regularly is vital for keeping the condition under control, as it helps individuals identify patterns and make necessary adjustments to their treatment plans. Effective management of diabetes also includes addressing related health issues, such as high blood pressure and elevated cholesterol levels, which are common among those with the condition. Your doctor may prescribe medications to manage these issues, reducing the risk of complications and improving overall health. Key advice for managing diabetes. Diabetes can lead to serious complications, such as cardiovascular disease, nerve damage, kidney problems, eye issues, and foot disorders. However, these complications can often be avoided or delayed with proper care. Diabetes education programs are a valuable resource for gaining the knowledge and skills needed to manage the condition effectively. Support from healthcare providers, loved ones, and mental health professionals can also help you cope with the emotional aspects of living with diabetes. Regular medical checkups are critical for tracking potential complications. These may include blood tests, kidney function tests, eye exams, and foot assessments. Early detection and timely treatment of complications can make a significant difference in outcomes. With consistent care and management, many people with diabetes live long and healthy lives. Thank you for watching. Don't forget to like, share, and subscribe to our channel for more engaging and informative health content. See you in the next video.